Should a young patient be subjected to the same risky procedure that killed her sibling, even when the alternative is certain death? Who decides, and based on what principles and what process? Should a family's religious beliefs determine the care that should be provided? When presented with such complex situations, public health professionals can employ mediation skills to empower people they serve by fostering meaningful discussion in order to reach a consensus. The College of Global Public Health at New York University prepares the next generation of public practitioners with a variety of essential skills necessary for today's public health paradigm. As with all online and hybrid courses offered by the College of Global Public Health, this course features three key elements: social presence, through the creation of relationships between faculty and students; cognitive presence, through exploration, collaboration, and reflections in a community of inquiry; and teaching presence, through our faculty's active guidance and facilitation. Bioethics has traditionally focused on ethical issues surrounding the individual. In recent years, there has been much more of a push to incorporate an ethical framework on a larger scale, more applicable to public health. Bioethics has become a field of study dedicated to analyzing the ethical issues in medicine and science. Bioethics Mediation is a multi-session course designed to introduce public health professionals to key skills and insights. They need to use mediation skills to navigate, foster better communication, and manage conflicts while paying careful attention to the rights, interests, and sensitivities of participants. Bioethics mediation is designed to enhance critical skills necessary to maximize the quality of interaction and prepare public health professionals for the thorny ethical conflicts that are an increasing and inevitable part of their practice. Once the foundational mediation skills have been laid, students will apply what they've learned to a series of role plays scripted by Professor Nancy Dubler. Students will have the opportunity to practice key skills through role plays that are grounded in complex and often harrowing real-life situations. These conflict scenarios guide students through the process from beginning to end and are designed to demonstrate how the various participants in any scenario have different commitments to issues and interests. It's vital to resolve differences between the values and desires of patients and their families, and the values and evidence-based position of medical practitioners' preferred treatment plans. Mediation skills and the role of the mediator can be immensely helpful in helping the parties reach a resolution. The course combines content from multiple experts, namely, professional mediators Leila Love and Josh Stolberg comprehensively cover the role of the mediator, beginning with the principles that guide their practice, and later, delving deeper into the practical considerations and specific skills that lead to a successful mediation session. Professor Nancy Dubler will provide a key historical view of the field of bioethics mediation, and will highlight where standard mediation differs from bioethics mediation. In addition to the three major faculty for this course, Professor Arthur Kaplan will also participate in setting the stage for the sorts of situations that lead to conflict. And Dr. Berkowitz will also share his deep and broad experience as the director of the largest clinical ethics consult service which exists, in the form of the Veterans Administration hospitals in the U.S. This course is being offered as part of the Masters of Public Health by the College of Global Public Health at NYU. The course will be held in a hybrid format, meaning that there will be some face-to-face classes, as well as some online classes and interaction. Students do not need to have experience in taking an online course in order to effectively participate in this course. Support will be provided to you. To find out more, please contact your CGPH advisor.